And good afternoon, everybody. It is August 18th, 2021, and we're here for the UBNet bi-weekly update on the Nevada County COVID situation. So thanks, everybody. We have not one, two superintendents. We have two hospital people, not public health people. We have two public health people, and we have the most important guy in the room, Ryan, who has all of the numbers and is going to give us the update and where Nevada County is. Ryan, you're on.
Thank you. And that is literally true because I'm the only person in the room that I'm in. So thank you for having me. I think I'll start by sharing a chart if that's something I can do, and it looks like I can. So you all have probably seen this chart before, but just to sort of demonstrate where we currently are, this chart goes back to, I believe, midsummer last year and shows the dramatic surge in cases that we had in December of 2020 that led to the state's regional shutdown order related to hospital capacity. And I know we all struggled through that time as a community, and the hospitals saw a dramatic uptick in their COVID census. And then with the waning of that surge and the availability of vaccines, we did start to see the COVID rates decline. Not as fast as some of the other regions in the state did, but still declined nonetheless, to the point where in June 2021, we got down as low as 26 cases over the course of a week. And then a couple of things happened. We had the lifting of the state's COVID restrictions on June 15th, and we had the introduction of a more transmissible strain of the COVID virus, the Delta variant, which I'm sure we'll be talking about significantly here today. And since then, we've seen our cases start to tick up at where we got to 60 per week, and then start to dramatically tick up where we had 128 and then 214. And then the week before last, we saw our highest case number of any week throughout the pandemic at 443. And then last week, again, at 438 cases. And so I think that's a pretty dramatic visual representation of what we have going on. Our rates are around 60 cases per day per 100,000. For perspective, purple tier back in the tiered system was 10 cases per day per 100,000. So we're about 6 times what would have put us in the most restrictive tier at that time. And that's about second worst in the state. The only county that has a worse COVID outbreak than us right now is Del Norte County. As we've seen throughout the pandemic, there is a pattern. Hospitalizations trail an upsurge in cases by a couple weeks, 2 to 3 weeks. And then tragically after that, we start seeing fatalities a couple weeks after that. And we've added several of them in the last couple weeks. I'll point out that there are more deaths that are known than are actually on our dashboard, because contrary to some of the pervasive beliefs out there, we don't just add a case to as a COVID death because somebody died and they happen to test positive for COVID. We wait until we get that death certificate and we validate that COVID was either the cause of death or a significant contributor. If somebody died of cancer and they happen to test positive for COVID, we don't count that as a COVID death, so that we know that there are more coming, but we haven't attributed that because we haven't been able to validate COVID as the cause. I want to talk a little bit about what we're seeing in terms of vaccinated and unvaccinated, because that's a big question that we get frequently. As of yesterday, we had about 106,000 shots administered to Nevada County residents of a 2-dose vaccine. That translates to almost 60% of our eligible population. So people over 12 that are fully vaccinated, and another 8% or so that are partially vaccinated. And I bring up those vaccine statistics in that context because I like to use the metaphor of seatbelts in terms of what we should expect to see with a vaccination rate like that. The state has and other sources have published that the Delta variant permeating, you're about 600% more likely to get COVID if you have not received the vaccine, between 600 and 800%. You can actually, so that's a highly effective vaccine, but it's not 100%, and you can actually do the math and uncork that if you're 600% more likely to get the vaccine or to get COVID if you haven't had the vaccine, and 60% of our population is fully vaccinated, you would expect to see about 20% of your cases in in vaccinated individuals. And so the metaphor I draw with seatbelts is that seatbelts are highly effective at preventing traffic fatalities. Yet if you have 80% of the population wearing seatbelts, which is indeed the case, you see more than half of the deaths are in people wearing seatbelts. That doesn't mean seatbelts aren't effective. It means that you have good uptake in seatbelts. And so you expect to see more of the fatalities in people wearing seatbelts. I don't know if that translates to everybody the way that it does to me, but what I'm trying to get out is that you expect to see about 20% of our cases in vaccinated people right now. And that is indeed what we're seeing. And then you have a lower amount of that, or a lower percentage of people who are getting hospitalized and experiencing severe COVID who have had the vaccine, and an even lower percentage if you're of people who have the most serious consequences of it. So I think I'll end on that note, because I know we have a lot of other folks to talk about a lot of other issues. So if there are any questions, I'm happy to try to answer them.
Thanks, Ryan. And the first question would be for Dr. Evans and Dr. Stevens. We got a couple questions from people wanting to know what happens when somebody comes to you and with suspecting that they have COVID. For example, people going to the ER or people coming in for a consult, are they separated out, or is everybody together in the same? And what about the mask protocol? Is that strictly enforced, yay or nay?
Well, I'll talk from the hospital's point of view. Yes, our mask protocols are strictly enforced and have been during the duration of this pandemic. And yes, we do separate out patients who have COVID from people who do not have COVID. And in some cases, we do have a surge tent that is set up actually in the parking lot by the emergency department, which is available as needed. We don't need it all the time, but in some cases, it's been very helpful to enable that separation that we're seeing. So we're certainly doing everything we possibly can to prevent transmission from one patient to another, and certainly preventing infection of our staff members as well when folks are coming in with COVID. And those are just basic things that go along with the prevention of infectious diseases that we've been well versed in since before the pandemic started, actually. But now, yeah, we are we are doing mandatory masks for all visitors as well as employees and physicians at the hospital.
And I can speak from an outpatient perspective. So at Chapaday, we do all of our sick visits actually outside under the tent, and that's where we do our testing as well. We've seen an increase definitely in the last couple of weeks with folks coming in for testing, as well as folks that have been sicker. And then we collaborate with the hospital to help with some monoclonal antibody treatment to prevent hospitalization there too. So thank you for that.
And a lot of people were really, really happy at the beginning of this week, because school started again. And so Monica and Brett, thanks for being here. And can you talk a little bit about what happened? I have somebody emailed a question and said that they have kids in various school districts, and what happened if one kid in a family of, say, a family of four with 4 kids gets sick. What's the protocol between the schools? Do you talk to each other? How does that work, and how is it going anyway?
Yeah, I'm happy to start with it, and thank you for having me. For the audience, I'm Brett McFadden, the superintendent of the Nevada Joint Union High School District. I'll start with just how things are going, and then specifically to the question real quick. The majority of schools in Nevada County and at charter schools came back to full instruction this week. So statewide, there was a directive from statewide that all public school districts and charter schools return to in-person instruction. And so we've done that. And so we don't actually possess the authority now to execute or instruct via a distance learning model like what we employed last year. And so we came in. Now at the high school level, we're a little different. Unfortunately, we've experienced in the last 36 hours a significant uptick in our reported cases. As of today, we're about almost 30 positive student cases throughout the district. Our trend line is very similar to what's happening throughout the county in terms of community rates overall. And so we're very concerned about that. We're working closely with Nevada County Public Health Office and other state public health officials on that. So we're doing all that we can right now to stay in operation in terms of in-person instruction, as well as student co-curricular and extracurricular activities. That means athletics. So as of right now, we're plowing ahead, but we've requested additional assistance and resources because the numbers are increasing significantly. And it does appear that the predominant cases are unvaccinated at this time. And so it's a struggle. So it's been tough. And so in terms of the question, we will be in contact with other school districts, but our primary mode of contact is when there's a positive case, is that we're notified. We'll share that with public health, and then there are protocols in place that both the state and our local public health office have put in place in terms of quarantining students. If students have been masked and are vaccinated, then there is no, and are not showing any symptoms, then the student doesn't need to be quarantined. If they were unmasked, then there's a modified quarantine. If they're unvaccinated, there's a modified quarantine. However, if they're showing symptoms, then immediately we're asking parents and students, do not come to school, notify us, but please do not come to campus. One of the problems we've been having in the last couple of days is a fairly significant number of students and families are sending their students to us with symptoms, and these are turning into positive cases.
I can share how it's going at the elementary and middle school level. So today we did have our first positive case. Our families will be notified this afternoon, and we have about 20 students who will be on quarantine. We started the school year with about 16 students unable to start the school year, and that's Nevada City School District. The tracking and tracing gets fairly complicated, and as Brett mentioned, there is the modified quarantine, but there's also, which we're looking at today, is a shortened quarantine, and that involves several very clear steps, and because the goal is to keep students in the classroom. So versus just quarantine for 10 or 14 days like we did before, we're really trying to keep students in the classroom if they're vaccinated, if they were masked, and if they have negative tests throughout the quarantine. So it's a tricky process, but we work real closely with the health department and make sure we're meeting all those standards. We do have about 671 students. So with about 30 students already out, 30 more just in the couple days, that's a lot.
Then the bonus question is, can we move to testing students and teachers regularly before entering the campus? And can the state provide support with that?
Yes, we actually have requested state assistance. The California Department of Public Health has a, I don't have the official, can't remember the official name for it, but something like a rapid reaction team. So we've asked assistance working with Dr. Kellerman and the local public health office for them to come on. Our intent actually is to implement by the first part of next week, to implement, if we can, daily testing of teachers and students. And that would be a primary mechanism for protecting the schools and keeping them open at this point. Because our concern is that if the numbers continue to increase at the rate they've been going the last 36 hours, it becomes increasingly difficult to try to keep schools open this day. I'll also share, just for the audience, is while our county is one of the highest in terms of its daily COVID positivity, we are seeing similar trends occur in school districts all through the state. And so in my communications to other superintendents in Northern California and Southern California, they're seeing numbers increase as they're coming back into full instruction and facing many of the same challenges.
And what kind of precautions, and I believe that might be for Dr. Trochet or Dr. Kellerman or Stevens or Evans, what kind of precautions are you advising for families given the Delta variant, especially for vaccinated parents of unvaccinated kids? For example, should the vaccinated grandma take a plane to visit the grandkids? Or should they avoid gathering indoors, outdoors with vaccinated people to keep the unvaccinated kids safe?
Lenny, you want to answer that?
Sure. So right now, vaccines are great protection, but they're not the only one. So combining them with masks are really important. And we're finding that people who are immunocompromised may not be as protected by the vaccine. And so that's why that third dose recommendation is being put forth. So in terms of keeping grandma safe, I think making sure that if people are around her are vaccinated and that, people are wearing masks around her. And then in terms of kids, and as soon as the vaccine's available to them, recommending vaccination there as well. I think there's been some misnomers that COVID-19 doesn't really affect children or that it's not as bad as the flu. But when you look at the numbers, actually COVID can affect kids 3 times more hospitalizations than the flu. And, I think we had around 300 or something deaths in children, which are preventable at this point. So please get vaccinated when you can and wear your mask when you're indoors.
Yeah, it's been mentioned many times. Of course, Ryan gave the statistics, but those are just statistics. We have some of the highest rates in California, second highest rate of any county in California. There's some hospital statistics that Brian could give also, that the hospital is, got quite a few COVID patients now, more than in the previous spike. So we've got a surge on the hand, but we're not unique. If you look at the map of America, I think Nebraska is the only state that the rates look fairly reasonable. So travel, I would not go anywhere, and I would kind of hunker down during this time. I certainly would not go out without a mask. I'd avoid any kind of gatherings, particularly if you're older or have some immunocompromise or have any questions. Just, this is a wait and see game, and it's best to wait without getting exposed. The real problem with the Delta variant is exceedingly contagious as compared to the original strain. There's 1,200 times the amount of virus in people's lungs. So if you just, a simple encounter could be difficult. Even for people that are vaccinated, you can get a viral exposure that can kind of overwhelm your immunity. The good news is that the vaccines are very effective at preventing hospitalizations and death. So yes, you may get exposed and you may have an infection, but traditionally it's very mild. The vast majority of hospitalizations are in people that are unimmunized.
I mean, one of the, I think maybe we'll need to get back to basics one more time, because there's quite a few questions about fully vaccinated people are getting sick. How are you going to try and stop that from happening?
Let's go. That's a huge question. I mean, we're doing everything we can. That's the reason we did the mask mandate. We always like the analogy of, the raincoat. If it's kind of misting outside and you got a raincoat on, you'll be fine. If it's raining, yeah, you may get a little wet, but if it's storming, you better bring an umbrella, and that's a mask. And so we recommend immunizations, and on top of that, masking whenever you're outdoors. If you're in a situation where you're going to be around others, or certain all indoors. A masking mandate is not new. Masks are mandated in schools and public transport, in any congregate setting, in hospitals. So, and every unimmunized person, it's mandated. I mean, this is not us. This is not a local order to wear a mask when they're indoors in a crowded environment. So, a lot of these prescriptions people know. And so we recently issued a mask mandate, which is essentially encouraging people to do the right thing. to protect themselves and protect the people that they love.
So the best way to prevent infections is to not spread the virus, and absolutely vaccinations help that, because even if you get infected, you're less likely to spread it to others if you're vaccinated. So vaccination first for everybody who can, masking indoors and outdoors if you can't keep 6-foot distance from others. And if you have unvaccinated folks, because they can't be vaccinated, like children where there's no vaccine authorized yet for them, you need to protect them by surrounding them with vaccinated adults and perhaps not attending large events where they could be exposed. And masking, wearing a mask when you're around others.
And speaking of the new order, why did it take so long for mask mandates to be put in place in Nevada County? I think this is actually the second one, if I'm not mistaken.
Yeah, there are a lot of voices out there, Pascal. We get criticized. How do we allow the fair to happen? Why do we allow schools to open? Why do we allow events to happen like Summer Nights? And why did we do things earlier? And then we put a mask mandate in place, and then people are saying, "You're not going to tell me to do." I know my freedoms, and we're free now after the June 15th, after the blueprint. We felt like the county was open and we were moving in the right direction. It's really hard to move the other way, really hard. And what public health does is just trying to encourage behavior that protects the public. And so, obviously, by definition of public health, we're looking at the health of the public. And individual freedoms may be infringed upon in the process to protect the public, yes. But right now, as Brent said, they're wrestling with the schools right now, and hospitals having trouble, but you can go to a restaurant that you want, you go to a theater, you can go to your place of worship. Just wear a mask, be sensible. That is a mandate, that is true. We have strong recommendations that when you're outdoors in a crowded area where you cannot assure 6-foot distancing, you also wear a mask. This virus knows no boundaries and no political persuasions, but it can be stopped by vaccinations and by masking. So, yep, I think that's a valid criticism. We probably should have issued it earlier, but we'd like to keep this county open, and the way you keep it open is by immunizations and masking.
I would just add to that, as you will have seen when I showed the chart, this is a situation that came on very quickly. We quickly went from having 60 cases a week to 400 cases a week. And additionally, much to the frustration of people who feel like it's mixed messaging, public health evolves with the science as the science changes. And going back to, even just a couple months ago, there wasn't necessarily science that vaccinated people can be spreaders of it to the same level that that recent studies have shown. And I believe, maybe our doctors can talk about this a little bit more, but the viral load and the nasal passages and such as the studies that have come out on that have really, that's an evolution of our understanding of the way the virus works. And we respond to that with guidance. And so it's partly that, the rapidity of this, and then being flexible and moving with the science.
And several questions about the fair, if we already see an amount of new infections because of the fair, or is that still too early?
I unmuted first, I think. So I'll just say what we've seen throughout this is it takes around 2 to 3 weeks to really see the impacts of an event. If you go back to last year's holiday season, like each holiday where people gathered, we saw an uptick in cases a couple of weeks after that. So I think we're all kind of waiting and seeing how things play out over the next couple of weeks. You have, the fair is largely an outdoor event that works in favor of this, but I think we would be, I think we should be expecting to see an upsurge in cases associated with that, as well as school reopening. We're already, as the superintendents have indicated, seeing cases in the schools. And so I think we have to closely monitor both of those situations.
And going back to the schools, question that came in is there a threshold? Do you have a threshold when you have a certain number of cases that there is an option to do online learning again, to go back to distance learning, just to protect the kids, the ones that are not vaccinated because of age, or to protect those that can't be vaccinated, and also the teachers? Is there any option at this point?
Pascal, that's a great question. The mode of instruction by all California school districts and charter schools is dictated by state statute, by the education code. So as of right now, school districts must be in person. We're required to offer an independent study option for students and families that are seeking that option due to their comfort level, or due to the fact that they have a medical or immune system challenge, either themselves or in their families. We have to make that option available to them. But we are not authorized as of right now to provide any sort of distance learning mode to all of our students at this point. And so what concerns me right now is, as we've seen now, as our schools are coming back and we've seen the rapid increase in the last 36 hours, if this trend line continues, it's going to become increasingly difficult for us to be able to keep our schools operational, because if we have additional students and staff beginning to be quarantined, we may not have enough substitute teachers. We may have so many students that are on quarantine periods of time that we can't effectively operate on a daily basis. So we are, from a I guess a state education standpoint, possibly being thrust into a catch-22 situation. We'll know more, and I wish I could say more, but at this point in time, I think my colleagues would concur. I can tell you that all education leaders throughout the state, particularly here in Nevada County, we're taking this, unfortunately, as sort of every 15 minutes or every 30 minutes, because things are changing so rapidly. Even during this webinar or this town hall, I've just received a text that I have 2 more students that are possibly testing positive. So it's an alarming situation, what we're seeing.
Yeah, and I'll just make a couple of comments. I haven't heard a question specific about this, but I do want to give folks an idea of what's going on at Sierra Nevada. And throughout the pandemic, my biggest concern is that we would end up in a situation where our hospital was overwhelmed with too many patients and not enough resources to take care of them. At the beginning of the pandemic, I think we were all talking about, okay, do we have enough beds and ventilators and all that kind of stuff, and then supplies. But what we've seen through the pandemic is that primarily the thing that's in shorter supply is staff. And it's been challenging at times during the pandemic to have enough staff. For the last few weeks, it's, with this most recent 4th wave of COVID in California, we have had a lot of challenges with staffing here in Nevada. So the concern I have is that it's going to worsen, before it gets better. We were feeling pretty good after the winter wave was kind of over with, and we hadn't heard about Delta yet. And we were kind of thinking, well, maybe this whole thing is behind us. I think a lot of people were kind of in that same mindset. And then Delta comes along, very contagious. And we've seen higher numbers of admitted patients in the hospital than at any other point during the pandemic. We actually got up to 29 hospitalized people at Sierra Nevada. The vast majority of folks have been unvaccinated, about 90%. And that's pretty consistent across the country. If you look at other hospitals, sometimes it's higher than that. It's primarily hospitalized unvaccinated individuals. So At this point in time, we've been kind of running in the low 20s on our census. Lots of people coming into the ER with COVID. Not everybody needs to be admitted, fortunately. But the staffing has continued to be a significant challenge. We've had folks go out. We've had our own employees get COVID. We've had lots of quarantine situations going on, and it's really impacted us, especially the nurses. So the nurses have had to do extra shifts. They're doing overtime. They're missing their breaks. They're missing their lunches. They're exhausted. They're feeling, in some cases, overwhelmed. They're also feeling, it's very difficult to take care of lots of patients with preventable infections. And so that's been really hard on them. And it's been hard on everybody. So at this point in time, I'm really hopeful that we're not going to see a significant spike as a result of people gathering together without masks, like they may have done at the fair or other places. Because we don't have an unlimited amount of capacity at the hospital to take care of folks with COVID. And when we get overwhelmed by COVID, it also impacts our ability to take care of other things. So, it could be strokes, it could be heart attacks, it could be, car crashes, it could be many other things. And by the way, Sierra Nevada is not alone in this. It's the entire region. I've also got Mercy Hospital Folsom, and we're just as impacted here, if not more so. And the other hospitals in Sacramento are absolutely jammed. So we don't have the ability to transfer out when we have high volumes of patients. We have to discontinue, in some cases, elective surgeries that we would rather do because we don't have the staffing for it. So it really is a point in time I think the community needs to understand. They absolutely have to do everything they possibly can to reduce the spread of this virus. And the key things are what Dr. Kellerman already talked about, which is get vaccinated. Please do that. Wear a mask and prevent infectious spread of this virus. It is really contagious and it is a serious term. So I'll get off my soapbox, but that's what is keeping me up at night right now.
And another thing is about testing, because of course with the increase in cases now, many people are trying to get tested either because they want to travel or because they are concerned. And when the testing is done, is there also, do we test specifically for the Delta variant or the Lambda variant, as the case may be? Are all samples, are they all analyzed to see if it's the variant, or how does it work, and what is about the percentage of the ones where genotyping is done?
So the test is for the virus, and the Delta variant is positive. The test that tests for the coronavirus, for the SARS-CoV-2, does detect Delta variant, as well as all the other variants in the original virus. So when you get tested, if you happen to have the Delta virus, the test will be positive. There's not the capability to check the genotype or to do whole genome sequencing for every specimen that is collected in Nevada County. But we can tell you that all the specimens that have been genotyped or had whole genome sequencing in the past 2 weeks, 100% of them have been the Delta variant. So it's safe to say that that is the variant that is circulating in our county. And if you get tested, the test will detect that variant.
Thank you. And okay, let's address this. I promise you after this one, I will let you go. We're going into overtime, but I think it's important to answer this question. What is the typical health profile of vaccinated COVID patients that are hospitalized, i.e. comorbidities, underlying conditions, etc.? In other words, is it really just old people that get sick or obese people?
Well, I could just tell you from the hospital point of view, again, most of the people, about 90% of the folks who are admitted are unvaccinated. So if we're talking about just the vaccinated folks who are admitted to the hospital, there's not tons of them. But generally speaking, those individuals have health problems typically. They're not usually perfectly healthy individuals who are being hospitalized with COVID if they've been vaccinated fully. I'm not sure I've seen any of that. Now, I haven't looked at the numbers across the entire country. I'm sure there's some examples where that's happened, but I just haven't seen that locally.
I have just gotten a slew of texts, but I want to be respectful of everybody's time. So in 2 weeks, you're all invited back. Please come back. Please answer more questions. And the only thing I'm going to ask you is, each of you, 30 seconds. What is the message that you want Nevada County residents to hear?
I would say, please
Sorry.
help the frontline healthcare team that is taking care of this community, not just for COVID, but for everything else. We are here for you, and we want to continue to be here for you, but we are really tired. We're really exhausted. We're in some cases overwhelmed. So do what you can. Wear your mask, like Dr. Kellerman said, and get vaccinated.
And I would echo Dr. Evans' comments. So if we want to keep our schools open and our county functional and such, then it behooves all of us to do our part. I know there are individual rights, and people have been vocal about that, but in a global and a community-wide pandemic, we all have to do our part. And so I'd echo that: wear your masks, practice appropriate social distancing, and be cognizant of your distancing. And if at all possible, please get vaccinated, and encourage students ages 12 and over to get the vaccine.
I think for me, I just want to put parents' minds at ease that, the schools are required to communicate positive COVID cases to families. Letters do go out within a day. I just know there's a lot of nervous parents out there, and we do communicate and reach out and make sure families know the situation. So not hearing something is good news.
From my perspective, I know it's hard to look at the big picture and be grateful in a moment like this when we see a surge in hospitalizations and cases at the schools. But last night I was reflecting. I've been personally deflated to have pinned so much hope on the vaccine for a year, and to finally have it, and then to be in this situation with the Delta variant and with people not taking the vaccine. But last night, as I was driving home, I was reflecting, well, if 90% of the people hospitalized are unvaccinated, imagine if 100% of our community was unvaccinated. And I'm so grateful for the vaccine that we do have, because the hospitals would be completely overwhelmed. The schools would be completely overwhelmed right now if we didn't have the vaccine. So I'm grateful to the vaccine, to everybody who's received it, to all the healthcare providers who played a role in getting that out there. So thank you.
Thanks. There's kind of an icon in medicine, a guy named Osler. And he said, the value of experience is not in seeing much, but in seeing wisely. We're 18 months into this pandemic plus, and I'm hoping we've developed some wisdom. And just like you've organized here, Pascal, you can see a sense of camaraderie and collegiality. And I hope these the wisdom of compassion and charity spread through our community, because that's what it's going to take to get ahead of this pandemic. Thanks.
I don't have much to add other than what everybody has said. Please get vaccinated. If you have to be out in public, please wear a mask.
And with that, thanks everybody thanks to our panelists. Thank you for your time. I know you are all extremely busy, so really appreciate you taking the time. Thanks to everybody who joined us here live, and thank you for your questions. Again, we'll have the next one in 2 weeks unless something dramatic happens. So please, let's make it so that 2 weeks from now, we'll reconvene and see how the situation is. Meanwhile, please, everybody be safe. It's not just COVID, it's also wildfires. So please, everybody stay safe out there, and we'll see you in 2 weeks. Bye.